is Career Day, and we have a very special guest. She is a nurse.
Ooh.
Yep, her name is Miss Rayburn. Let's give her a big round of applause.
Hi kids, thank you for having me. Today we're going to learn about the exciting history of nursing.
Ooh.
It all started when... During the 1800s, the image of nurses transformed from that of a prostitute to a professional. Early in the century, women in jail would serve out their time in hospitals as nurses. However, after Florence Nightingale's contributions to the field, nursing became an acceptable profession for young women. Toward the beginning of the century, many people, especially physicians, discouraged higher education for women, claiming it caused infertility. However, after Nightingale created hospital training schools for nurses in England, American nursing leaders followed suit. Hospital programs generally lasted a year or two, with students working 8 to 10-hour shifts and attending daily classes. A major event for nursing occurred in 1893 when nursing leaders gathered to found what would become the American Nurses Association. Their organization recognized the need for national unity in licensure and state registration, but did not formulate a means to enact these ideas. Prior to 1861, most nurses were men. The Civil War brought such an urgent demand for nurses that men begrudgingly allowed women to help in the war efforts. Since few schools existed for nurses, most of these nurses had no experience or training. Near the end of the century, student nurses staffed most hospitals, leaving trained nurses to find other jobs. A nurse's duties included bed baths, vital signs, charting, and setting up medicine trays. Nurses were to be submissive and could not question a physician's order. During the 19th century, nurses recognized the need for cleanliness not only during surgical procedures, but also in all parts of acute care. Scientific developments impacting nursing include anesthesia, sterile technique, and implementation of the scientific method.
Licensure and regulation of nurses were becoming necessary to prevent patients from receiving inadequate care from incompetent nurses. In 1901, New Zealand became the first nation to regulate nurses. Several states passed nurse licensure laws in the early 1900s. However, these early laws continued to allow untrained persons to practice nursing as long as they did not use the title registered nurse. Nursing education was provided primarily at hospitals, rather than colleges or universities. However, nursing leaders understood the needs for academic knowledge and promoted educational reforms that resulted in college or university-affiliated programs for nurses. Hospitals used the student nurses as cheap labor. After graduating, most nurses worked as private duty nurses, making home visits and tending to the needs of the patients. Community and school nursing became successful in reducing the spread of communicable disease. American Red Cross experienced phenomenal growth during World War I. Over 20,000 nurses were recruited to serve in the military.
During the period of 1920 to 1940, nurses wore calf-length dresses. There were still white uniforms worn, especially in nursing school. Color was added using the undergarment worn under the white sleeveless dress, and caps were also still part of the attire. Education-wise, nurses needed a high school diploma, satisfactory grades, screening tests, and prereqs for the nursing program. Licensing exams were written by each of the 48 states. Nurses were known as the general practitioners. There were nurses who worked in the hospitals and nurses who went from house to house to care for the people in rural areas. Science and technology was starting to change with new developments. The iron lung machine came out and it helped people having trouble breathing breathe. The use of radiation therapy to care for cancer patients was being used in several hospitals regularly. Lastly, the electroradiograph machine was becoming popular to treat heart diseases. In 1929, the Great Depression affected many, including nurses. Nursing schools and programs were at its peak at the time, and higher educational requirements were required. Nurses were in high demand because of extreme poverty leading to many illnesses, and numerous people were in need of medical attention. However, there were several nurses that turned to other lines of work because of hospitals and nursing schools closed down due to lack of funding, leaving countless nurses without jobs.
In the 1940s, nurses' uniforms consisted of dresses, aprons, and caps. The dresses were calf-length. The uniform kept the nurses looking professional. When nursing students graduated, they were allowed to take part in the capping ceremony. The certificate was received along with. During World War II, medical school classes were accelerated. A new program of study was introduced, reflecting the health issues of war. In 1943, federal funds were approved to train nurses. The curriculum was accelerated from 36 months to 30 months, where in 6 months, students had a practical assignment in their home or military station. Post-World War II, a new type of technical education was proposed, a 2-year program to receive credits at a community college. This program started in 1950. Scientific advancement in the 1940s proceeded at a rapid rate. The government established offices to oversee all wartime scientific and technical. While studying penicillin notatum, Alexander Fleming discovered an active ingredient in the mold. This was eventually used for making penicillin, which is the earliest discovered and most widespread antibiotic.
The image of the nurse in the all-white uniform stayed pretty constant throughout the early 1960s and 1970s. Hospital nurses were still required to wear this traditional uniform with white hose, shoes, aprons, and caps. In the 60s, color started to appear in the uniforms, but the aprons and caps remained white. The caps were an important signature to the level of education nurses had. Generally, student nurses had all white caps, associates nurses had 1 stripe, and BSN nurses had 2 stripes. Military nurses who fought in the Vietnam War wore pants and various military uniforms. As the late 1970s approached, some nurses started to rebel against the caps and uniforms, which eventually led to the current use of scrubs. During the 1960s, nursing had a large movement into the university. The American Nursing Association decided the minimum education for a nurse should be an associate's degree, but a professional nurse should have a bachelor's degree. The nurse practitioner program was conceived at the University of Colorado in 1965 by Loretta Ford and Dr. Henry Silver. It focused primarily on the pediatrics and was a non-degree certification program. The degree for NP did not exist until the 1970s. A lot of technological advances came to nursing in the 1960s and 70s. The ICU was developed in Vancouver, British Columbia in 1968, and a lot of complex machinery was developed to help save critical patients' lives, including fetal and cardiac monitoring, automated beds, suction machines, and oxygen tents. One of the major impacts on nursing in the 60s and 70s was the Vietnam War. There were about 7,500 U.S. military nurses in Vietnam, which included Navy, Air Force, and Army nurses. They worked 12-hour shifts 6 days a week. The war was dangerous, and because of new technology and warfare tactics, nurses were exposed to seeing grotesque mutilations of soldiers. Exposure to such traumatic events often led the nurses to abuse drugs and alcohol as a way of coping with the stress. On their return home, as many as 40% of the nurses struggled with PTSD. Re-entering civilian life was difficult, and many were left without help, as the U.S. was not prepared to deal with so many traumatized veterans returning.
The nursing image from the 1980s to present has changed drastically. Although the 1980s saw the end of the nursing caps, nurses were still required to wear nursing dresses with aprons, nursing shoes, and no jewelry. The 1990s marked a drastic change in nursing attire. Nurses began wearing nursing scrubs of various colors, styles, and sizes, jewelry, and a variety of different shoes, including Crocs and tennis shoes. This attire has carried on into the 2000s. In the 1980s, the most common form of education attained by a nurse was a 3-year hospital diploma program. Nurses were trained at the hospital in an apprentice-like style. In 1980, 54.7% of all nurses had a hospital diploma. By the mid-1990s, the associate degree became the preferred form of education. The 2000s marked the pursuit of higher education, and many nurses began pursuing a 4-year baccalaureate degree. There are also master's and doctorate degree programs. As was common in the 1980s and is still common today, the nursing field is primarily made up of women. In 2008, a staggering 93.4% of all nurses were women. Of this workforce, only 16.8% of all nurses were not Caucasian. Since 2004, there has been an influx in the amount of males and minorities entering the field of nursing. The role of a nurse is forever changing. However, the core duties from the 1980s to the present have been about the same. Although job duties vary per department, many of them are still the same. These include recording patients' medical histories and symptoms, giving patients medicines and treatments, observing patients and recording the observations, operating and monitoring medical equipment. In 1980, 66% of all employed RNs worked in hospitals. With the pursuit of higher education, this number has slowly decreased and the need for nursing has become more diverse. As the need for nurses grew, so did the pay. In 1980, the average salary for a nurse was $17,398. In 2008, the average salary for a nurse had almost quadrupled to $66,973. The 1980s to the present has marked an unprecedented amount of technological advances in nursing. Such advances include computers in healthcare, safer medication administration, electronic medical records, electronic health records, a puddle guppy for aspirating bodily fluids and liquids, and an aqua box or hand sanitizer.
Nursing history, America Kings. What do you guys think?
I want to be a nurse.